What's going on, everyone? Happy Friday and happy 4th of July to everyone who celebrates 4th of July today. Hopefully everyone is doing well, staying safe, healthy, and tested negative for the viruses. It is time now for the 4th of July virus update for Friday, July 4th, 2025. If you are new to my channel, welcome to my channel. This is the channel where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to know what's going on with each and every one of these viruses. That's where I come into play. I keep you informed with the latest news, data, wastewater, anything I can find to keep you informed on the viruses, not just in the United States, but other places around the world. Want to stay informed? Subscribe to my channel down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. Already, we do have several things to get through today, despite the fact that it is a holiday here in the United States. So let's get right into it. And I thought, given it's 4th of July, we would start off on a lighter note today and a little bit of statistics here. Get this, on July 4th in the United States, there is a staggering number of hot dogs that are consumed. It is just really insane how many hot dogs are consumed in the United States. According to the National Hot Dog and Sausage Council, who knew that was even a thing, which they swear is a genuine trade organization, we'll be eating 150 million hot dogs today. Yeah, that is a huge number of hot dogs. In just a few minutes, there'll be the hot dog eating competition. Nathan's, Joey Chestnut will be there. How many will he eat this year? I don't know, but that is a high number of hot dogs. Hopefully, none of these barbecues where you'll be consuming hot dogs also contain a side of COVID. Hopefully not, or any of these other viruses. Now moving on to some not so good news. Star Wars actor Kenneth Colley has died at 87. And get this is something we do not see much this day and age. They are saying it is from contracting COVID and pneumonia. Yes, an actor has died of COVID and pneumonia, and they're actually admitting that was the cause. Yes, this is not good whatsoever. He contracted it recently, and unfortunately, it has been confirmed on Thursday, July 3rd, that he did die of the virus. So, yes, Kenneth Colley, Star Wars actor, died of COVID. All right, in Ghana, see, I told you we go international here. The University of Ghana has contained a outbreak with no severe cases, and it looks like they had 107 confirmed cases with this outbreak among 316 people that were tested as of July 1st, 2025, all exhibiting mild symptoms. Now, we've heard that word mild before. Is it actually true for everyone? Well, everyone gets COVID differently. All right, moving on to this. A few things from Dennis, the COVID info guy. First off, Queensland, more flu cases in the first half of 2025 than in all of 2024. Yikes, that's not a good thing. Up to June 29th this year, 29,514 cases have been recorded already, outstripping the 24,708 in all of last year. More than 5,300 cases have been recorded in fortnight alone. Yikes, that's a lot of cases. Moving on now to this. COVID-19 outbreaks in Australian residential aged care facilities. July 3rd, 2025. Looks like active cases are 1,850. Active outbreaks, 260. Resident cases, 1,302. Staff cases, 548. And reported deaths are 269. Deaths went up by 23. Everything else, though, this is some good news. Everything else did trend down at this time. All right, South Australia at this time. Weekly respiratory update, June 28th to July 4th, 2025. Reported cases. COVID, 464. That's up by 1.3%. Flu, 1,627. That's up by 28.3%. RSV, 365 cases. That's up by 9.6%. Pertussis, yes, this is a weekly thing they track. 57 cases, and that is up by 17.3%. Reported deaths in 2025. 33 for COVID, that's up by 1. Flu 5, RSV 5, pertussis 0. So good to see that number at 0. India, taking a look at the active COVID cases there, and I'm refreshing this. I think it already is. No, there it goes. 1,181 active cases. Let's see, did they record any deaths? Looks like they have one new death added this week or today in India, not this week. They've had more than one this week total. All right, in Alberta, Canada, new measles cases decrease. In Ontario, Alberta sees 74 new cases in the last week in Alberta. And let's see, Alberta has the second highest number of measles infections in the country, with 1,179 reported as of Thursday, including 74 over the past week. So, yes, it is starting to slow down for measles there. That is a good thing. But here in the United States, we're still dealing with measles problems. More measles outbreaks put U.S. total within single digits of modern day record. Yes, in its weekly update yesterday, the U.S. Centers for Disease Control and Prevention, CDC, reported 40 more measles cases yesterday. It says today, but this was yesterday, boosting the number of infections this year to 1,267, which is just 8 shy of passing the total in 2019, which was the highest since the disease was, quote, eliminated in 2000. So this is not a good thing whatsoever. The largest measles outbreak in the United States so far this year is clearly Texas. Texas has had a rough go of it, but things have slowed down in Texas. There are still other states, though, like Wyoming the other day reported their first case of the year. All right, taking a look now. If you did not see yesterday's virus update, I noticed many did not. Here's what the UK reported this week. 1,125 weekly cases. That's down by 199, or 15%. Deaths, 58, down by 2. Healthcare, we're skipping that number because I don't understand why it shows these big increases or big decreases, but yet the number up here is constantly always similar. Now that says positivity rate, 7%. But if we come down here, you'll see the positivity rate has dropped. And the UK, we've been following it here since, I shouldn't say the early days of the channel, but we've been following it for a while. And last summer, UK had multiple waves. I don't know if that's going to be the case this year. Maybe they truly will just have one wave this summer and no double peaks like last year. Take a look at the viral activity level in Canada. COVID-19 is moderate. Flu A is low. Flu B is low. And RSV is in the low category at this time. Hey, here's a reminder for you. I have a website, DatarReport.info. That is my website where I do, basically it's an archive of information. COVID, measles, other viruses, all kinds of tracking threads for sports-related illness. That has been a big problem this year. And then, of course, we do have on there where I do these posts. Not every day, but from time to time I do the post with the news stories using the virus update. I did post one for yesterday. I think I'm going to post one for today. And yeah, my website, datareport.info, free to become a member. Anyone can become a member. All right, if you're going to be outside for maybe fireworks, barbecues, or many different things, well, first off, here's the daytime air quality. Now, it doesn't look great in the east, and there's some problems in the southwest. This will get worse tonight. Why will this get worse tonight? It's the 4th of July. There's going to be a lot of fireworks tonight, so if you have a breathing condition, COPD, asthma, maybe something else, maybe it's long COVID, please be mindful that fireworks tonight, there's going to be all that smokiness in the air. This map probably is going to look pretty bad tonight, and to be honest with you, I think I may make a post on X if I remember to. I may make a post on X tonight showcasing what this map looks like during the peak of fireworks. Now, mind you, they're going to start first in the east, or my hand should be this way. They're going to start first in the east and then make their way to the west. So the east will look bad first and the west will look bad later. But to be honest with you, there's some not great air qualities in the east. You may notice my voice is a little off today. Yeah, I've been coughing, my breathing. It's not been a good day for my asthma. And, well, take a look at the air qualities here. They're not fantastic, so that is a problem. Despite the fact that we're actually having a really nice 4th of July. It is only 81 degrees here, and the humidity is low. The dew point's in the 50s. Here's the breathing index for Friday, and you can see it's not great here where I'm at in southeast Pennsylvania. And some of that does spread back down to the Gulf Coast. Look at southern Texas. Some oranges there. some oranges, even some reds in California. That's not a good thing. Great if you're in the Pacific Northwest. Great if you're in the Northern Plains as well. Taking a look at what's going on with the pollen levels today. Not that bad. A lot of moderate here. We're not seeing very high for grass pollen. And I don't show tree pollen anymore because that is no longer an issue at this time of year. It's very minimal at this point. All right, taking a look at what's going on in Pinellas County, Florida. And unfortunately, there's quite a few people sick on 4th of July. We do see sick person calls. They are a thing there, and we see a bunch of other things as well, just random stuff. Philadelphia yesterday. Things are going in the wrong direction in my city. 867 EMS incidents, yet again, really high, right? I think we're going back into one of those summers where it's going to be north of 800 for the majority of the summer. We saw this happen last year. Yeah, not a good thing whatsoever to see all these EMS calls. Live looking at Montgomery County, Pennsylvania. Look at this. 15 EMS calls. I wonder how many of these ambulances had to leave a 4th of July parade because they got a call. It could have happened. Matter of fact, it does happen. I've witnessed it happen before at a parade many years ago. Take a look at Chester County, which was busy earlier. And, yeah, continues to be busy. This is busy for a holiday. But you know what? Illnesses, falls, heart attacks, all that stuff does not stop just because it's a holiday. Cardiac arrest in West Whiteland Township. That is not a good thing whatsoever. Moving on to Bucks County, Pennsylvania, which is something we just started viewing this week. Why? Because, well, they never had a CAD system before. And we do see respiratory distress showing up here. They had 11 calls. If you notice, I have to manually refresh this to get it up to date. They had 11 calls earlier, and there were several respiratory calls. That's something I'm seeing pop up way too often as of lately. Hospital situation in Pennsylvania. I'll refresh this in case it changed a little bit from this morning. But you can see here, yeah, there's a few hospitals dealing with problems. Not terrible. Southeast Pennsylvania, it's constantly going to have an issue because so many hospitals have closed over the years. Just this year alone, we lost a couple of hospitals here in Southeast Pennsylvania. And a reminder, the XFG variant has now taken over in my state of Pennsylvania. Yes, XFG is now a dominating variant here in Pennsylvania. Taking a look at what's going on with the New Jersey hospitals, I did see a problem earlier. Yeah, facility divert for a power outage at JFK Molenberg. I don't know what that's all about. I guess they just lost power and don't have a generator. Someone posted a comment the other day. There were hospitals that just do not have generators, and I am assuming that it may be one of them. I don't know what's going on at that hospital. New York State yesterday, they won't update again until Monday, maybe even Tuesday. 387 total positive cases. Not rising there yet. They may start rising next week. And patients hospitalized, 238. All right, we do have some CDC data to look at. Before we do that, let's take a look at some data, the midweek update from CJS. And Florida, 825 new cases were reported on Tuesday and 1 new death. New York, daily numbers, 127 new cases. Some might have been removed from prior counts. Puerto Rico, 627 new cases on Tuesday. And Maryland's weekly number was 398 new cases and 5 new deaths. Virginia, 698 new positive tests and 7 deaths reported by the CDC data tracker last Friday. And Texas reports 1,186 new cases to go along with 284 hospitalizations and another 21 deaths. Now for his Wednesday update, just a few states here. Florida, daily cases, 770 new cases and 8 new deaths. I will say this, Florida's cases right now are lower than they were at this time last year. That's some good news. Maybe less people are getting tested, or maybe the waste's just not as bad, which is possible, despite what we're seeing in wastewater. I mean, wastewater's pretty bad in Florida. We'll look at wastewater in a little bit. New York, 252 new cases. Puerto Rico, 529 new cases. Washington, weekly number, 383 emergency department visits, and 5 new deaths. All right, let's pause, folks, and take that hydration break, because I really need it. My throat is just all congested. All right, doesn't that feel much better? Strange that my breathing's actually bad today because, and someone's going to say, have I tested for COVID? It's not COVID, it's asthma. Every once in a while, it gets worse when the air qualities are bad, which is surprising because I just got my asthma injection the other day. Yikes. We'll see what happens. Anyhow, moving on to this. emergency department visits diagnosed with COVID. And you can see here, it's been corrected. And it is now going upward a bit. We're not going to look at the all the states. We'll probably do that tomorrow. Got to save something for the weekend. But we are going to look at this, which did update yesterday. And we normally do look at this on Friday. Yeah, look at the number of growing, or more so I should say, likely growing states now. It has really increased. Almost half the states on this map. I'm not going to sit here and count how many, but you can see here, growing status. You can see Alaska's growing, Texas, Oklahoma, Mississippi, and this is for COVID, my friends. Likely growing, Florida, South Carolina, North Carolina, Tennessee, Alabama, Maryland, Indiana, Missouri. We're now seeing Arizona, Utah, Idaho, Washington, Oregon, California, all likely growing at this point. And still likely decline in New York State. I think that's going to change after 4th of July. And then we do see things are definitely declining in New Mexico and likely decline in Hawaii. That doesn't make much sense to me because wastewater shows something else. All right, LA, the positivity, Los Angeles, California. The positivity rate for COVID did go up ever so slightly, or the percentage of specimens testing positive at this time. Yeah, it did go up ever so slightly, but it is still not very high yet, but it went from 4.10% to 5.46%, so it is going upward. All right, got to take a look at wastewater here, because there has been some changes when it comes to COVID. First off, national wastewater trend, I think it's going up ever so slightly. It's not really rising much here. They completely changed this. I think there's got to be some issue going on. Take a look at this. Yeah, does that look different? Here's the levels. The Northeast is now medium. Southeast is medium. The West is medium, but I don't have much confidence in this data. We're going to take a look here in northern Idaho, and apologies, I'm not going to try and pronounce that and make a fool out of myself, but take a look at this. COVID, high and straight up like a rocket? Does that make any sense? No, I think that's an error. There are several different wastewater sites that just look wonky, do not look right, but at the same time, we are seeing some legitimate things going the wrong direction. South Parker, Colorado, I believe this is one of them. Yeah, now this is pretty well zoomed out, but you can see here, they are starting to rise at this point, and let me refresh this. Sometimes yeah, that's better. Sometimes it goes zoom. If you go to a wastewater site that is really zoomed out on a chart, then they all start appearing that way. But if you refresh the page, it corrects itself. Yeah, South Parker, Colorado is high, and it's legitimately going up at this point. Then we go further west, Utah. Yep, there's problems there. Utah, high and starting to rise. And we're seeing some high sites starting to show up in California now. There's at least 3 of them that are Santa Cruz. What's going on here? We haven't looked at this in a while. Yeah, that is listed high at this point. Now, that could be wrong because it says upward trend in the last 21 days and a medium concentration. Sometimes that indicator does not match what they put here in the text. I'll never understand why that is. Let's go to the east. We'll go somewhere in the southeast and then somewhere in the northeast. And that somewhere is just going to be Florida. Look at all these high sites in Florida. That is just really bad at this time. We did lose, however. I'm just noticing this. New Orleans was listed high a few days ago. Now it's only listed at medium at this time. Let's take a look at what's going on in the northeast. And again, things have gone to medium here. And we can see, let's try for Newark, New Jersey. And look at that. Things are still dropping at this time. And to be fair, we do need to go to the Midwest as well. Let's go just to the west of Chicago. Glen Elwyn, Illinois. And we can see here, things are starting to go up slightly. So that's something we're going to have to watch. It's still listed very low here, though. So that is some good news. And again, repeating, this is where we're going to leave you off. The epidemic status map for COVID in the United States is starting to change. We're starting to see those likely growing stage colors show up in more states, and we do see not changing now in a lot of states that were either declining or likely declining or not estimated, which is telling me that things are starting to trend in the wrong direction. Alrighty, folks, that does it for the 4th of July update. Please remember, just this final reminder, if you're going to celebrate 4th of July, maybe you're doing fireworks or something, please be careful, and if possible, leave the fireworks to the professionals. Please be safe. And remember, if you are positive for COVID and don't feel well, please, you can't go to those cookouts and barbecues today. Alrighty, give this video a thumbs up if you like it. Subscribe down below. Hit that notification bell. Share this video with anyone you know. Of course, leave your comments down below. Ways to support the channel are down below. I will see everyone again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic holiday. And have a fantastic Friday if you don't live in the United States. See you tomorrow. Bye-bye.